Our world has gone through a doorway, and many of us are being called to serve in a new way. Whether you're a doctor, a healthcare worker, a therapist, a teacher, an energy worker. The question is, are you ready? Do you have answers to some of the questions that your clients will be asking you now? How will you focus your energy psychology interventions now to help them to move through this doorway? And how are you doing yourself, answering the big questions that this disease is asking you to answer? Dr. Rizvi and I, Mary Seiss, have crafted this pre-conference workshop to include teachings of masters from many different traditions. Traditional Chinese medicine, Yogananda, Buddha, Sufi masters, Master Jesus, and Her Holiness Saima, to stretch your model of viewing disease. We'll discuss different levels of consciousness and client awareness and demonstrate the importance of bridging information. We will teach you how to get clues from the chakras and the body so that you know how and where to target your energy psychology interventions. There is nothing we will teach you or share with you that we haven't personally used for ourselves and with our patients. And because we're so committed to you, to personally, to understanding all of this information, we are also offering 2 gifted group calls later in May. So you can ask any additional questions that occur as you begin to implement these teachings into your work. As a past president of ACEP, I warmly encourage you, as always, to attend the Energy Psychology Conference. This year it'll be virtual and it'll be awesome. And Dr. Rizvi and I warmly invite you to join us to see disease as a doorway to something far greater, remembering who you really are. Here's a sneak preview of Dr. Rizvi speaking on disease as a doorway. Thank you.
How most people relate to disease. They think it is a nuisance or a thorn in their side, and they want to do anything possible to get rid of it as quickly as possible to return to the life that they remember, that they know. It's like an imposition from the side. They're going here, and there's this thing that's preventing them from having the normal life. Instead, what could be, and what I offer, is the disease is actually a doorway to go through. And who you are on the other side of that is totally different. You can't go back anymore. A lot of people want to, but you can't. You can't just get rid of the disease. If you have cancer, you go for surgery, you try to get rid of it and go back to your normal life, it's going to come back. Maybe not in that form, but I swear it will come back because the underlying issue, who you are, the state of your being hasn't changed. So it'll just come back up again. So if we see disease as a doorway, if we see it as an opportunity for growth, and we take it on as that, it's scary because who we're going to be is different than who we are now. But that's the call. We're being called to be a different person, to be a different form of ourselves. And the disease tells you what that is. It gives you that opportunity because the disease is a manifestation of the blockage of you fully embodying divinity, right? And the form of how you are resisting divinity shows up as that disease. It's like key and keyhole. It's right there for you. It's just how we respond to it. And on the other side of that doorway is a different world. Now that doorway could end up being a tunnel. right? It's not just a one-time thing where you experience it over a course of a couple of days, then all of a sudden you're on the other side. It could be a tunnel, and those are challenging. That's chronic disease. That's where you have to walk through all the way and be a different person on the other side. And that's a whole other category of opportunity, but it is an opportunity. And it can be a challenging one because there's a temptation to want to turn around and go back. But they can't ever go back. Anytime you think you want to go back, that's not the answer.